Welcome back, everyone. I hope you had great engaging discussions. I attended session 3, and I just wanted to say how lucky I am to hear and learn from your experiences and stories. It was great to hear all the women in this session, and especially when Camila Fernandez said the pandemic accentuated the previous tough situation for the LGBTQ plus community. It resonated with what's happening in Mexico, the importance of creating safe places for the community, stigma-free services. Before we move on to the next round of sessions, we want to hear from you too about these sessions we've just had. Please tell us in the chat or join on one of the discussion threads on the topics. We'd love to see your thoughts on social media too. And now let's welcome back our speakers from the breakout session, who will tell us about the learnings from each session and how we can collaborate and work as partners moving forward to ensure that no one, no woman, adolescent, or child is left behind. You each have 2 minutes to tell us the key takeaways emerging from your session to address the challenges raised in your discussion. So please, let's start with Purnima Menon, Senior Research Fellow, International Food Policy Research Institute. You have the floor, please.
Thank you so much. It's a real pleasure to be with all of you here today. So the session that I was in was on social and economic determinants of health. And one of the things that we discussed very clearly there was that the pandemic and the associated control measures, including both lockdowns and economic slowdowns, have had profound implications for people's lives. We discussed how hunger, food security, nutrition, sanitation, and the economies have been affected in different areas, but also how sectors have responded, such as the social protection sector and the WASH sector, including the private sector in many parts of the world. Our panelists came from South Asia, Ghana, and also we had some fantastic global comments. Now, in the session itself, the participants signaled that economic uncertainty was emerging to be the most critical impact of the pandemic, and really that this required tremendous support to come together to address the lives and the living conditions of women and children around the world. And in our session, we basically closed the discussion sort of acknowledging that what we needed to address the conditions that are going to affect women and children really across their life course in the next few years is both the creation of economic opportunities and the protection of economic opportunities, even in the context of control measures for the pandemic, but also deep investments in social protection programs. We are particularly interested in seeing that social protection programs that actively reach women and children, that targeted social protection programs that reach those age groups that PMNCH and this community is very concerned about, are going to be absolutely critical, because without that, we are not going to be able to affect the social and economic determinants agenda, because the impacts of those determinants are so cross-cutting, they're so profound to the lives of women and children, that we absolutely have to bring into place the social protection and economic agenda to reach these communities. So in a sense, we end with a massive call to action for targeted social protection and targeted economic support and rejuvenation efforts that reach the families and households of especially vulnerable women and children around the world. Let me stop there. Thank you for the opportunity again to represent that group and to be with all of you today.
Thank you, Purnima. Kaveri Maira, doctoral candidate, University of Southampton, and research midwife in India. Tell us about your session.
Thank you so much. I had the pleasure of moderating this session on importance of healthcare workers in the COVID response, and particularly on investing in midwives. We had expert panelists Joe Moyer, Sandra Oyarzo Torres, and Jihan Salah joining us from 3 different parts of the world. And it was a very interesting discussion, particularly because we got to start talking about the State of the World's Midwifery report. This is the 3rd one, and it released just last week on the 5th of May, on the International Day of Midwives. And I think this was an important session and an important conversation to have now, because the world is focusing on healthcare providers, on frontline healthcare providers, especially midwives. And what we learned from all our panelists is that there is absolutely a need for investment in midwifery, no matter where you are in the world, which country you are a part of. The needs can be different, but the challenges remain, starting from your pre-service education, your in-service education. There are not enough jobs. As we understand at the moment, there are around 900,000 midwives that are lacking. And when they can be hired and be a part of the global healthcare community and workforce, they can save over 4.3 million lives annually by 2035. But a lot has to happen to achieve that kind of goal, to avert maternal deaths, neonatal deaths, and stillbirths, and to provide care that is compassionate and respectful and dignified. We understand that the needs are very different in different settings, and particularly in humanitarian and conflict settings. We also discussed how lives have changed, and the importance of midwives and their role has been discussed in COVID-19, midwives' conditions, the burnout, the level of work that they have had to do, the fights they have had to have. Those all were very raw, and participants discussed it in such great detail. We also had representative from International Confederation of Midwifery, midwives, where we discussed the importance of regulation for all of it, for education, for practice. To do absolutely everything, we need associations of midwives in countries that do not have them yet. And those who do, we need to strengthen them. And I think one main point that was being echoed by everyone was the lack of midwifery leadership and role in decision-making at absolutely every level and in policy making. And that midwives have to be a part of this and lead the change and lead the midwifery-led care. And I think I would end with these words that came from a participant in how midwifery fights patriarchy, which I think needs its own separate session. But with that, thank you so much for giving me the honor of moderating this wonderful panel. Over to you.
Thank you, Kaveri. Camila Fernandez, welcome back. Travesti trans advocate. She decides 25 for 25 young leader, Argentina. Tell us, Camila, how was it?
Thank you, and hi everyone. So I was part of the Let's Talk About Sexual and Reproductive Health and Rights, Violence and Gender Equality session. And our highlights were that, first of all, let's have a right-based comprehensive view of what the pandemic means as regards the lack of sexual and reproductive health and rights. Let's use the evidence we have, the information we have at fingertips to write our actions, the things we are going to commit and to do in order to make the quality of life of our communities better. Let's be conscious about how humanitarian situations or emergency situations may affect also the impact. Our panelists from Indonesia said that gender-based violence were increased during the pandemics, but also because of the natural disasters and the context make things worse also. Let's be conscious about how visibility and mental health is important for more than anything, the vulnerable and marginalized groups such as LGBT community or young people. Let's be optimistic. Let's be an ear when you need it. Let's be empathetic, because keeping safe our mental health is pretty important during this pandemic. And well, also let's have key coordinations with governments, institutions, grassroots organizations. Let's try to act as an as a combo, let's say. So the you know, how it works would be definitely better and unstoppable.
Thank you very much, Camila. And now to you, Ranjana Kumar, Head of Health Systems Planning, Management and Performance. Gavi, the floor is yours.
Thank you very much. And I really heard all the previous panelists with really a lot of interest, and a lot of those really resonated with what came out in our group as well. We had a very distinguished panel with Dr. Amir, former health minister from Ethiopia and current senior advisor with the Global Financing Facility, Stephanie Yeo, a civil society advocate from Cote d'Ivoire, and Dr. Mark Hansen, a noted economist and an academician. We actually ran a poll with the audience on what are the areas that they would like to hear. And we posed 3 questions that for the session on most impactful pro-equity strategy for mothers, children, and adolescents, what are the choices? And the choices were between increased domestic allocation of resources, creating enabling policies to identify and reach those most vulnerable and marginalized communities of mother, children, and adolescents, and an enabling environment for social accountability. It was very neck to neck, no real straight answer there. But the creating enabling policies to identify and reach children was slightly ahead. So I will start with that, with my key takeaway. So some of these takeaway messages were around political will, and because of the COVID pandemic and its aftermath, let's capitalize on the political will, which is already there. And this political will has to be unconditional political commitment from all parties, ruling party, opposition party, and it has to be really aligned with an in-country and a donor response as well. So there has to be alignment, and there was a discussion on how we have to walk hand in hand or in shoulder to shoulder with all the country governments, the communities, as well as the donors. There was also a very strong recommendation for partnership at a local level. And they said micro level financing partnership. That means the community voices have to be heard, and we can only do that much better in most impactful pro-equity strategies if the community voices are also integrated into what we are doing. The second takeaway was really about more financing and more equitable financing. And there was a recognition that early life sets you on a path of inequity. If you're born too soon or you're born in the poorest quintile, you really are left behind to a healthy start to life. And there was also recognition that the finances are not only increasing finances, but they have to be matched with mutual accountability and partnership, as I've mentioned before. And the civil society organizations also have a role to play in this partnership. The other big point which came in this was on the informal sector, which is not valued, whether you're a housewife or you're a daily wage laborer or working in an informal sector. You still contribute a large extent to the GDP, but you are just not recognized. And there was a recognition that we should recognize countries and humans, not as their market value, but really as a human value. And the last point was really around data. We really need to look at data, have transparency around budgetary allocations, how they are used, and really make a case for investment in women, children, and adolescents. And again, a last plea on community voices to be included. Thank you very much. Over to you, Ilana.
Thank you all so much for the inspiring work and for sharing your experiences to make these discussions during the breakout sessions so meaningful and rich. We are hearing how important it is to have the tools and the systems along with the political will to mobilize resources needed to achieve greater equity, and most of all, to put women and children at the center of the health system and the decision-making progress. What amazing participation so far. Let's keep the ideas, thoughts, reflections going in the chat and the social media hashtags, COVID Call to Action and Lives in the Balance, at PMNCH, at Gavi, at the GFF, at Core Group DC. That has given us all a huge amount of insight into these issues, the progress made and the gains lost, and what more needs to be done to reduce inequity, particularly for women and girls. I know many of you have been posting your comments in the chat, so let's make sure that others are hearing these messages and calls for equality at this critical time. I am now very happy to announce our final sessions for the day in the LITB3 Marketplace. I am now very happy to announce in the Marketplace sessions, you will hear from AMREF Health Services, Ideas 42, Medical Aid Films, ViteTalk, and the White Ribbon Alliance, as well as others who have and will share innovative practices in education, expanded opportunities, and enhanced services delivery for the health workforce. To join these Marketplace sessions, you can go to the Marketplace tab at the top of your screen and choose your session, or click directly on the sessions from today's agenda tab. Once again, we will ask you to please stay on mute in case the discussion has already started, but you can post your questions and comments in the chat. Thank you all.